Now that we've worked on the external structures, let's work on the internal structures. I'll get you to open your mouth there a little bit. We'll start with the lateral pterygoid. So what I'm going to do is I'm actually going to go up and I'm going to follow the upper teeth right to the end here, and then I'm going to go a little bit superior posterior. Are you okay there? Mm-hmm. Is that pretty sensitive up there? Mm-hmm. Now, the key thing here is not just to use your finger inside here, but actually go on the outside. You can actually feel the muscle there. And so we're going to take our time here and kind of work around a bit. Are you okay there? Uh-huh. But that's pretty sensitive, isn't it?
It is.
Yeah, okay. So in terms of how many times you do it, you probably go back and forth. It could be somewhere 3 to even 10 times. But for some people, we'll be able to tolerate very few passes on this. From there, we're going to slide over just a little bit, and I'm going to work up into the cornoid. So we're going to work on the temporalis here. You okay there? Mm-hmm. Okay, so as we did on the external, we sometimes have to go way up here, and we're actually going to go back and forth here. And I'm taking my hand and going a little bit superior. So it's kind of like you're moving into the cornoid here, but then you're going to be stretching both sides. So I literally can feel the stretch between my hand here and my hand up here, that the tissue of the temporalis is being stretched. You doing okay there? Mm-hmm. And again, we're not in a hurry, just a nice stretch here. And I'm actually going to change my position and move around a little bit on the temporalis. Like right there, I can feel that stretch. Mm-hmm. Can you feel that stretch all the way from the temple right into the area there? Mm-hmm. Okay, good. And from there, we're going to go, and we're actually going to go on the medial pterygoid. So I have to go in the lower teeth, slide right in, go really slow, and you get to the end there, in between the upper and lower teeth, and just stop there. Now, are you okay there? Mm-hmm. And just ask to make sure, because this is very easy to initiate a gag reflex. You're going to take your thumb on the outside here and kind of move in towards the thumb. Good. Now, it's really important that we use both hands in this procedure. If I take away this hand here, do you feel the difference on there? Mm-hmm. It doesn't really do too much. Mm. If I'm here and I go in, then it really helps to open it up. And again, you may be able to do very few passes on that. The last one we're going to do here in terms of the internal structures is going to be the masseter. Open your mouth there, and I'm going to go on the inside, and I just want you to clench your teeth together. And that'll pop right up, and you can really feel that. Opens halfway now. Now I'm right on the body of the masseter, and the main thing here is we're going to go in opposition. So as one finger goes down, the other one goes up. And there. Let's just turn to the side a little bit so we can catch that on the camera a little bit better. Good, perfect. And up, and take that down. Good. And up, and down. Good. And up. Perfect. Okay, now that we've gone over the external and internal, you'll get a better idea of what the 10-point TMJ protocol is all about. This is very effective for multiple conditions. It's not just TMJ problems, but this is a major part of the kinetic chain. If we're dealing with headaches, we have to deal with tension throughout the shoulder, the neck, and this greatly affects the jaw. And a lot of people will find that they actually won't resolve their chronic tension or cervicogenic headaches if we actually don't work on the TMJ structures.